So again, this is Tanya Sherry from Health Leadership and Learning Network, Faculty of Health at York University, and welcome. Thank you for joining us today for our webinar on psychological health and safety in the workplace, leading in the COVID-19 context. Nancy Dubois, who is our primary lead instructor for the Psychological Health and Safety Certificate Program here at York, has prepared an intensive and packed webinar for you. So I want to get us going now. Just a few pieces of information before we start. You are all muted and also your videos down so that we can conserve our bandwidth and make sure that our Zoom does not crash with everyone joining us today. If you would like to send us a message, I'm sure you're used to this now. You've all been using Zoom or some other way to communicate online. Please go to the chat line and you can ask us questions. Nancy has allotted some time during the presentation to answer your questions, and I'll be fielding them to her. And she'll also be able to look at them. Please know that too that we're recording the webinar. So if someone hasn't joined that you know of that wanted to join, you'll certainly be able to share the webinar with them. We'll also be pushing it out on our social media channels and sending it to you post-webinar through the contact that you provided. Hello too from New Mexico. We have quite a global attendance today. I noticed in our signups we have people coming from several parts of the world, including our colleagues in the United States. Welcome. And just still admitting some people. People are still coming in. But without further ado, we have an hour of your time. Hello from Cambridge, Ontario, or maybe Cambridge, UK. Either one, welcome. And without further ado, I want to now introduce Nancy, our speaker today, and get this webinar rolling. So Nancy Dubois has spent the span of her career focusing on initially physical activity, but also wellness, especially workplace mental health, wellness, and promotion. And more recently, focusing on the new psychological health and safety standard that Canada has now produced. And again, she's the lead for our Psychological Health and Safety Certificate program that we run here at York University. Nancy is the proud recipient of the Queen Elizabeth II Diamond Jubilee Medal for her leadership in physical activity across Canada, which took her to work internationally in countries such as Chile, Bosnia, Finland, Serbia, and Italy. Nancy also focused on workplace mental health promotion and, of course, psychological health and safety, and as well as wellness in the workplace, and has worked with such organizations across Canada, such as the Psychology Foundation of Canada, the Canadian Mental Health Association, the Health Communication Unit at the University of Toronto, and has done a lot, extensive community-based workplace health work, such as toolkits that are in use in such areas in Ontario, such as Waterloo and Haldimand, Norfolk regions. She's also worked in the area of chronic disease with Manitoba Chronic Disease Prevention Alliance around a workplace health training, such as events and conferences. And this work also extends across Canada with the Heart and Stroke Foundation in Ontario, Nova Scotia, and BC around active workplace initiatives. So Nancy comes to us with a wealth of experience, and she's here to talk to us today about the context of COVID-19 and the psychological health and safety in the workplace. Welcome, Nancy.
Thanks so much, Tanya, and it's great to be here. I'm so enthused that there are planned over 300 people joining our webinar today, so welcome. As Tanya mentioned, you come from all over Canada. There's people from England and Ireland, many of our US states, and I think when I looked at the registration list yesterday, the winner from the farthest away is Fiji. I wanted to also thank you for the few questions that you were able to answer when you registered for the session, because it really has helped me hone in on where some of your areas of focus are. Most of you do work in the health or social service sector, so that's driven me to be a little more specific within that realm for what we're going to talk about today. I did want to make special acknowledgement for our colleagues who have joined us today, who are either in the flood-ravaged Fort McMurray, Alberta disaster, or those recently affected by the Nova Scotia massacre. You're dealing with even more than the rest of us are. So I've taken the time for this afternoon to divide our discussion into two parts, and I'll break partway through after the first part to allow the opportunity to answer either questions or we can share some of your comments. There likely will be more than what we have time to deal with, so we will be following up, and we'll talk a little bit more about that at the end of the webinar to share with you some of the thoughts that are coming through from that format. So please do feel free to add your comments in that chat feature. So the first part, I wanted to spend a little bit of time just introducing you to the National Standard of Canada for the Psychological Health and Safety in the Workplace initiative. That was another of the registration questions that you graciously answered, and there were 48% of you who were not at all aware of this, and an additional 43% who were somewhat aware. So I thought it is worth some time to think a little bit more about that and introduce you to it. Then I want to take the remainder of the time to have a much more specific discussion with respect to the COVID-19 pandemic situation, particularly as it relates to the healthcare sector and healthcare workers, whether you be a leader, a manager, or staff. This webinar has been preceded by an article that I was encouraged to write through the Helen Network, and that dealt primarily with the issue of workers who are working from home and some of the challenges that again relate to the standard with that. So I won't touch on that. That's another resource that's available if you're interested. I will finish up at the very end with a slide that shares the references and sources that I've used throughout the webinar. There's not very many of those, but they'll be there for you if you're interested. So let me take you to this overview of the standard. This has, sorry, just a second, I just have to move my slide. The wrong thing. So this was a resource that was developed initially. It was commissioned by the Mental Health Commission of Canada, published in 2013. So it's been around for a little while. You'll notice the URL on the slide here is where you can download it for free. At this stage, this is not a mandatory requirement like we have in the health and safety world, where there's all kinds of legislated requirements that workplaces have to meet. Not yet is this a mandatory resource. But it is the best we've got in terms of a standard for due diligence if a workplace, an employer was to be judged for their mental health or psychological health and safety practices. It's becoming more and more commonly used. Workplaces of different sizes from different sectors all across the country and beyond have begun to adopt this particular standard. Today is not the time where we're going to delve into it in a great deal of detail. There are, I'll touch on a few sources of where there are additional resources to find out more. And as Tanya mentioned, we do have a course on this. However, the premise of it is a management system. This is not a one-shot set of activities that you undertake and kind of check off on a list that, yep, we've done that. It's a comprehensive approach to the psychological health and safety in a workplace. And I'm going to share with you an overview of this system. And if you thought about it like any other system in a workplace, it could be your accounting system that you put in place. You may have production or distribution systems. You have patient care systems that you develop and implement. Some of those are based on guidance documents or responsibilities of colleges and those kinds of things. This is the same sort of approach. It's a thing that would overlay all of what you do around psychological health. So the actual framework is up here on the screen now, and I won't go through all of the details of this. The essence of it is that it starts with a mission that an organization would adopt, often a policy to say, this is important to us, or they incorporate psychological health into their current mission statement of their organization to really position this as something important, something of value. The drivers describe why a workplace often cares about this, what's driving their participation. Risk management is one area that we'll come back to a little bit later. Sometimes there are cost efficiencies and cost effectiveness strategies to incorporate. We've got organizational excellence and sustainability, so sort of retention strategies would fall under there, as well as recruitment for new employees. The framework is built around three kinds of work: the prevention, promotion, and resolution of psychological health issues in the workplace. What I really wanted to focus on, and we're going to come back to these in just a few moments, are these 13 workplace factors. So when you think about what's happening in your workplace, whatever role you play, these factors describe the kinds of things for which there's an opportunity often for improvement, or at very least sustainability of good practices around these 13 things that influence positive psychological health in a workplace or otherwise, but these have been customized for the workplace setting. So again, we're not going to take a lot of time to go through each one of these individually. The standard itself, that document you can download, does an excellent job. There's an annex or appendix at the end that describes these in great detail. So I really encourage you, if you haven't seen the resource, to really have a good solid look at it. It lays out that system approach that looks at how all of this would become implemented in a workplace. So when we think about this management system, I wanted to just give you a sense of what the overall intent or the goal of this is. And so this comes directly from the standard. I won't read you the details on here, but it really is looking at a standard of care around psychological health that elevates a workplace to a position of excellence. So it's a gold bar to strive for. And certainly there are sort of benchmarks or milestones along the way. With those 13 factors in mind, some workplaces will identify a few to focus in on initially. It's overwhelming to try and address all of them at the same time, nor may not be a need to address all of them. Some you might be doing very well in. There are tools and resources that accompany this standard. They come from a variety of organizations, and I'll come back to some of those sources in a minute. But they all reinforce the same concepts. They use the same language. So there are assessment tools. There's a survey, for example, that a workplace can implement, both a short version and a long version. There is an implementation guide, so that if you were in the role of facilitating the uptake of this within a workplace, it gives you a bit of a manual of how to approach it. There are all kinds of short video clips that explain these 13 factors, many times for the purpose of trying to encourage either an employee base and or a management team to understand and appreciate the value of addressing something like this. What I did want to point out in these four sort of assumptions or understandings that underlie the standard, it often is about trying to improve or at least mitigate the way we behave towards one another at work. We have a duty to prevent harm to one another's mental health. The second point, and also the fourth one, reinforce in that those pillars that I mentioned, the drivers earlier in the framework. One of them had to do with risk management or risk mitigation. And so the second and fourth points here are quite germane to that, looking at identifying that certain human needs that can and must be met at work in order not to put people at risk. And that is more of an individual kind of look to risk, whereas number 4 speaks to more the corporate liability, which is unfortunately a reality of needing to protect our corporations, our organizations from litigation and all those kinds of things. And that this is, I've mentioned earlier, a form of due diligence to be able to do that. So let me take you to these 13 factors in a little bit more detail. So these are called psychosocial factors that affect psychological health and safety. I should mention that this word psychological has been very intentionally attached to this standard instead of using mental health and safety. And the reason for that, one of the reasons, is that the confusion that often exists between mental illness, mental health, and what's becoming more and more a common term is mental injury. And so by replacing that mental health with psychological health seems to help people differentiate a little bit more. So this system is not about the diagnosis and treatment of mental illness. It is about the prevention and promotion and protection of mental health, or in the case of our standard, the psychological health. So through some early work by an individual by the name of Dr. Martin Shane, who worked out of the University of Toronto, he's retired now, but he was very influential in developing, even before the standard was a standard, the really underlying theories and best practices around the concept. And so these 13 factors have been identified as the core pieces of work to really delve into identifying how are things working? Are we doing things well? Where could we see improvements in? And as I mentioned earlier, you probably wouldn't be able to tackle all 13 at once. And so something like an assessment or a survey would help you organize your plan around ones that are maybe particularly higher risk at the moment. There's maybe been a lot of complaints that have been filed of late, or it could be related to incidents reports that have been happening. So much like you might do in the physical world of health and safety, you're mitigating the risks that are already there. Those often have to be taken care of pretty quickly so that no one else gets hurt. You eliminate the problem. Then you can turn your attention to the prevention, and then sort of along the continuum of work, you're continually trying to promote the concept of psychological health. So I won't go into a lot of detail on these, but I wanted to give you a chance just in your own mind. And I know some of you have joined in teams of 2 or 3 people, so you might want to just have a bit of a conversation. I'll give you just a minute or so to think about this. But to put this into your own context, think about your workplace. And it may be a little different now than it was a month or 2 months ago. So you might want to even compare in your own mind, where were we at the beginning of 2020, and where are we now on some of these factors? This is certainly not a scientific survey by any means, but it might give you a chance to assess your priorities around these different areas. So let me just pause for a moment and let you think about these factors. The reality is that when stress as an organization is high, for whatever reason, it could have to do with workload overall. It could have to do with change management strategies. Certainly, the pandemic situation we all find ourselves in now has touched every part of all of our lives, and that creates stress. And so some of these factors become exacerbated. And if a workplace hasn't really thought about how to support workers in some of these, that's where difficulties often arise in people's mental health capacity, their mental health care, self-care, and it can become extremely detrimental. I'm going to share with you at the end a quote that I think really kind of epitomizes the situation we're in now. So to be really cognizant of particularly if you're in a management role within your settings, where if there's an opportunity to pay particular attention to some of these at this time and go a bit above and beyond what you might normally do with respect to things like civility and respect or engagement. And I'm going to delve into a few more particular strategies with respect to what you might be doing here. So with respect to our flow today in the webinar, I'd like to pause now. I'm going to turn the slides off for now. We'll come back to them a little bit later. And just turn to Tanya and give you a chance to sort of react to what you've heard, any comments or questions that might have arisen. So Tanya, over to you.
Hi, everyone. So I'm looking at the chat. Don't be shy. Please enter any questions or thoughts or reflections that you have on what Nancy's just presented so far. We have someone who mentioned earlier they're a manager of a brand new firm in Toronto concerned about psychological health of employees during COVID-19. And I mean, my question, just to start us off, Nancy, is if you are in a smaller organization and you are the manager, you're not the health and safety person, who do you go to now? Like, who is the team you're assembling to think through this? Where would you start?
With our health and safety regulations, at least in Ontario, and they're similar across the provinces of Canada, I'm not as familiar with how they operate in other countries. But most workplaces will have some group or individual that's been designated as a health and safety lead. Depending on the size of the workplace, the legislation changes from having the need to have an individual, then it moves up to a committee, and often in large workplaces, you actually have hired staff who pay attention to this. So that's your go-to start. Usually there's, and it might be just one person putting their mind to this, reading through some of the requirements. And the next half of what we're going to talk about, I will share with you some more immediate and specific actions that are specific to our COVID-19 times. So that health and safety association person committee is really your starting point. The second one, and depending on again, the size of your organization, is to get the support of a senior manager, president, whatever the kind of highest level, it could be a board of directors, whatever the structure of the organization is, to at least preliminarily provide the go forward on, yes, let's look into this. And with the pace that things are happening right now, that can often need to be a very quick decision. And it doesn't mean commitment of money or anything like that. It's just a commitment that this is an important thing to delve into and explore in more detail. So I really position those two as your first starts.
Thanks, Nancy. I have a few more questions. From Nathan, can a workplace adopting these different types of applications, I would assume apps means applications that exist, help with all of this? Like these wellness or resilience apps, even the trending e-health and apps such as CBT apps. Thoughts?
Absolutely. If you look back to those 13 factors, many of them talk about sort of self-management, and there really is, in my sort of interpretation of this, or in the elements of the standards, there's really two sides of the coin. One is helping individuals cope or prevent the stressful situations in the first place, or cope with them as they arise. So there's a skill development, and that's where some of these apps come in, where people are assessing their stress levels, they're practicing breathing or mindfulness, all those sorts of strategies at an individual level. The other, which are often the more, well, not often, always the more difficult ones, are the organizational strategies, the ones that need to be addressed from a management standpoint. Sometimes it's about the practices in the workplace of workload management. It may have to do with employee engagement strategies. Those probably aren't as well handled through the app kind of approach. Those are going to need some strategic thinking. They may need some resource deployment to engage the actions on those. So from the individual side, absolutely. I would be careful in terms of promoting particular ones until you're sure of the quality of them. If they reference elements of the standards, I would suggest that probably does have a little higher level of credibility to them than others. Maybe we have time for one more. Is there another question?
Okay. Yes, there is. Cheryl is asking about.
I see one here about a workplace social committee.
Oh, okay, that's a little further down. Yeah, I'm on a workplace social committee. I'm hoping.
Can you want me to speak to that one?
Sure. I've got an earlier question.
Okay.
Yeah, Cheryl is asking if assessment surveys for staff, I guess during these times, should they be anonymous?
Interesting question. They're in the survey protocol. It depends on the size of your workplace. If there are less than, I think the recommended number is 15. I'm not positive of that, but it's around there. 15 in number, then absolutely they should be anonymous. There are levels of anonymity that you can include in some of the more standard surveys that are attached to the standard, where they can identify work units. So perhaps you have satellite offices where you'd like to understand how these factors differ by location, or it could be different departments in a workplace where you'd be looking at operations differently than administration or something like that. So there's kind of associations that you can identify in the survey. Often the questions are they're delving into some people's personal opinions. So in general, from an individual identification perspective, absolutely anonymous. But as I said, there are some work units that are able to be identified.
I've got one more question from an employee, Nancy, but maybe we should save it for later because I know you're going to actually delve into the 13 areas, but it's from they're asking about what an employee should do if they're observing something. Do you want to answer that later or now?
That is a perfect segue into what we're going to do. So let's do that. And then if we don't get to the specifics you were looking for, we can come back towards it at the end.
Great.
So in terms of the next piece, I want to, and I have the reference for this at the end of the slides, but give credit to a document that the British Psychological Society has recently released. It's a guidance document for healthcare workers, and it's labeled as the psychological needs of healthcare staff as a result of the coronavirus pandemic. And it's an excellent 3 or 4 page outline that I'm going to draw a particular set of examples from and share with you a little bit about what else is in there if it's more where you're at. So what they've done in this guidance document, and I've not found one elsewhere, I've been looking around for specific to COVID-19 practices, and this was the lone wolf that I could find. So they have identified 3 phases of what our communities, what our organizations, what our societies are going through. And they've labeled them as the preparation phase, the active phase, and the recovery phase, which makes perfect sense. It's kind of common sense. But what I wanted to do is give you a bit more of the details of what these 3 phases are like and what the impact specifically on psychological health is thought to be, and then follow that up with some strategies of prevention or mitigation. So the prevention, or the preparation phase, we are most past that. It was a very short phase. It's labeled as one that is focused on anticipatory anxiety. So we don't know what's coming. We didn't know what was coming.
Nancy, sorry, it's Tanya. Can I just interrupt for a second? Do you want to put your slides back up?
No, I don't have a slide on this one.
Okay, excellent. Thank you. Sorry about the interrupting.
No, that's okay. So this preparation phase is usually, in this case, with the COVID situation, was very quick. There wasn't a lot of time to plan. There wasn't a lot of time to secure group input or do a fairly in-depth assessment of what was going on. We're living that now. So the preparation stage is really kind of morphed into the action phase. If this was not as much of a crisis situation and you were preparing for perhaps work on some of these factors, that could be a much more standardized, much more planned out, strategic preparation for where you're headed, but such is not the case as what we're working with now. So to give you a little bit of the characteristics of this preparation phase, planning may happen at a high level in a rapid time frame, leading to anticipatory anxiety about the unknown. With limited time to plan and limited input into this phase, many staff may report feeling unprepared for the outbreak. And as I said, many have passed through that phase already. The second one, which is the one I wanted to spend more time at, because it's for the most part where we all are, is the active phase. And they've separated this into what I felt was a really strong differentiation between 2 phases of this overall active phase. One being called heroics and surge to solution, the other one by disillusionment and exhaustion. And that latter one, the disillusionment and exhaustion, is where the greatest risk to psychological health comes from. So let me give you a couple of descriptors for the heroics and surge to solution. So sometimes there's actually a positive piece to this, where you might see increased camaraderie as staff cross boundaries and work together in teams that didn't exist before, or people are taking on new roles. There's a sense of rising to a challenge. We can do this. We've got this. We're feeling okay about this. Staff may respond more on instinct, so therefore there may be some prone to error. That's where some of the risk management may come in. They are so driven by what the day-to-day, minute-to-minute work is. They may lack the headspace to really think through options and alternatives, especially in these situations where we don't always know what the right protocol is, or the current protocol, because it changes. Frustrations and role confusion as people try to adapt quickly within the current design. So change isn't easy for anyone generally, and it is happening so quickly. Staff witnessing things they've never seen before, and often bringing with that a feeling of a lack of control for their situation. Some of those things, when you see nurses and PSWs carrying bodies out of long-term care homes, it's wartime kinds of trauma that some people are experiencing. Disagreements between groups over senses of urgency. So that's just a few. There's others in the full paper, but it gives you a sense of the things that many of you are living. The other side of this phase, being the disillusionment and exhaustion, is, as I mentioned, the area of potentially highest psychological risk. You're in full go mode. You are getting tired. Your personal wellness may be suffering as a result of the working conditions that you're in. You may be running on automatic pilot in some cases. You may have some moral distress and actual mental injury as a risk of where the healthcare becomes limited. People are unable to act or respond within their own moral or ethical code, whether that's a professional code or just your own personal standards. Staff may begin to feel emotionally disconnected, not only from their work, as some of their colleagues are no longer there. They've come down with the virus themselves and had to leave. There's less people to do the same amount of work, if not more. So there's a disillusionment with the sort of the fairness and the justness in a workplace. Referring back to the standard for a moment, there are 4 dimensions that often are the matrix by which we assess in a very quick and dirty kind of way, not to the extent of a survey, but it's called demand, reward, effort, and demand, control, reward, and effort. And so when you're in sort of more normal, more calmer times, you may feel like you've got a little bit more control. You may be reaping the rewards of vacations or an actual 8-hour shift or a 10 or 12-hour shift rather than what might be happening now. So that matrix is completely out of whack. So you have less control. You're seeing fewer rewards. You don't have the same kind of, there's a greater degree of effort perhaps, or different effort than what you're used to. So that balance between those 4 dimensions is really different in these days. So we're going to come back to that active phase, because I don't want to leave you with the fact of, oh, well, here's how bad it is. I want to finish off with some strategies of what you might be able to be improving or changing or addressing. But before I do that, I'll just tell you a little bit about the last phase, which is the recovery phase. And some of us, given what our jurisdiction is, where we're living, are starting to enter into this phase. We don't know, again, lots of unknowns about how long it will last, how gradual it will be, and it will change with the decision makers in each of our government jurisdictions. But in an ideal world, here are some of the things that a recovery phase would allow for. It's the looking at trying to prevent some of the longer term psychological damage or impacts that may have started to occur in that active phase. So giving staff time to start to reflect on what's been going on. Most staff will feel able to cope successfully using their own preferred style and individual resources, like the individual who mentioned the apps that are out there. My daughter happens to be a manager in a grocery store in a very large town or city, and things have leveled out a little bit now, but she found a really helpful resource was the deep breathing, calming apps on her phone that she could just do when she needed. So those kinds of things to let people cope in their own way. However, we know that not everybody is able to do that. So some more operational, some more organizational, some more strategic resources, whether it's through an EAP, employee assistance program, your benefit packages, providing them through third-party individuals can be very helpful to people who are either coping without their own personal style in place or just need some extra help. Some may experience intrusive thinking about what they should have done differently. There's often a feeling of guilt that attaches to this now that you have a chance to sit back and reflect on what happened. Others may feel differently about their job and experience resentment towards what happened or didn't happen. So hindsight being 2020, we could have done this, we could have done that, we should have done something else. So again, not all the details in there. We may want to come back to that in another webinar later on when we're closer to that phase of life. So let me take you to the last piece here before we open it up again for your comments. And I'd really encourage you to think now and put them up into the chat box so Tanya can organize them a little bit. As I identified, there's 10 principles that go along with this active phase. And these are the options to think about. Think about your own situation and offer up to your colleagues here additional thoughts or opinions, strategies that have worked, maybe even some that didn't work so well. And we'll have a chance to talk about some of them and we can share them afterwards if we don't get to all of them. So as I share these 10 principles, as I mentioned, this was done by the British Psychological Society, and they don't use the same psychological standard that I introduced you to at the beginning of the webinar. However, you'll see a lot of similarities in these 10 principles, the first one being quite a clear one. So in these times when we're actively working in this pandemic response, the number one, and these are not necessarily in rank order, visible, available, and supportive leadership. So we see in Canada every day, there's a series of press conferences that start with the Prime Minister, work down to the provincial level. We see not only the elected officials, but the staff, medical officers, and chiefs of police and naval commanders in today's case. So we see a very clear laid out step. Not everybody necessarily agrees with it, but it's pretty clear and they're very visible. That can happen or needs to happen at an operational level within organizations. So are there regular memos coming out from the CEO? Is there leadership being demonstrated? So they're changing things that need to be changed and listening. The second one is related, having a regular and frequent communication strategy. And that involves using multiple media so that people receive repeated messaging of the same basic message. That the communication needs to go both ways. So is there an opportunity for staff to provide input and engage with expressions of concerns or fears without necessarily any promise that all of them can be dealt with, but at least there's an opportunity to put those forward. Many of those may become things for consideration in the recovery phase as you move forward. Number three is ensuring consistent access to physical safety needs, such as PPE, but also personal protective measures, which is an example would be healthy nourishment, a little bit of exercise every day, sleep. Those may be luxuries in many cases, but even if there's a little bit of attention given to them and some opportunity for it, can go a long way. Number four of the 10 is to ensure some form of human connection and methods of pre-existing peer support. So some examples of this might be a daily huddle with not necessarily all staff, but some staff. It might be just with a buddy, but some opportunity to watch out for each other. What are you experiencing? What can I help you with? When in some situations, those of you who work in health and social services, which is most of you, are probably familiar with the concept of vicarious trauma or compassion fatigue, where people who work in this day in and day out get overwhelmed and often take on the characteristics or the difficulties that their patients and clients are experiencing. Having that buddy who's experiencing something similar can be an important way to not only vent, but also problem solve a little bit. Part of that human connection, if there is the luxury to provide a little bit of safe space for staff to be together, even for a while, and not necessarily all staff, but that they're not necessarily alone unless they want to be. Number 5 is providing psychological care to your clients or patients. That can be very self-healing. If you've done something to help patients connect with their family, their loved ones, their relatives, it can be a key to staff well-being as well. So helping to establish some systems of communication where a patient or a resident in a long-term care facility may be able to FaceTime with their adult children or their grandchildren with the help of a staff member. And so those are healing, not just for the patient, but also for you. Number 6 is to normalize psychological care or psychological responses. That it's okay to not be okay. None of us are okay in this. I mentioned earlier, we've all been affected in multiple ways through this, and to try and pretend that we aren't, it may not be the healthiest approach to take. So giving staff permission to step back when they need to, or ensure that they get a bit of a break or a bit of a rest. I know it can be a scheduling nightmare, and in these times where we don't have as many staff as we might want, it's pause for consideration as to how you might be able to do that. Number 7 is to deliver formal psychological care in stepped ways. So in Canada, we have a program called Mental Health First Aid, and in Britain, they call it, I think it's the Psychological First Aid, and it's meant to be an awareness in colleagues to be able to recognize when a coworker or a staff member, a manager, whomever, a colleague at work, is experiencing mental health challenges, even to the degree where it might be an indicator for some sort of mental illness. That's the sort of the extreme of all of this. So some will need those kinds of supports, and the recommended kind of hierarchy, if you picture a Maslow's hierarchy of needs, for example, is looking at the base being where we are in many cases right now, basic needs and physical resources. So those PPE things, the food that people need, those kinds of basic requirements. If people need a little more support than that, tier 2 brings information and peer support to the table. And so for some, that's enough. That gives them the support and has filled that gap that they need. Tier 3 gets a little more clinical, of looking at ways such as psychological first aid or mental health first aid, intervening in the ways that people have been trained to. It's not something that everybody knows or even is comfortable to do. And then the 4th tier being some sort of psychological intervention if it's needed. So if your workplace hasn't considered the extremes of these, maybe it's time to think about having somebody on site trained in mental health first aid, for example, or being able to know who to access in the community who might be. So if you are a relatively small business, it might not be something that an individual on site would be, but an organization like the Canadian Mental Health Association might be your go-to resource for those kinds of things. So be ready as needed. Number 8 is to innovate, to implement psychological care, but in a coordinated way that's consistent with your policies and principles of compassionate care. So this just becomes another way of supporting employees as you would with any other instance: bereavement, grief counseling, some sort of chronic disease or acute disease that's happened. How would you care for those people in those kinds of instances? Replicate the care that you'd give to their psychological health. Number 9, next to last, come back to your core professional and organization values in making decisions. This comes back to that preparation phase where we don't always have a lot of time to make these important, quick decisions. So as you are in this active phase where maybe you do get a little bit more time to think about things, and especially when you don't have time, to really rely on the values and practices that have kept your organization sane and healthy to this point. And then the last one is the take care of yourself. This is a marathon, not a sprint. We've heard that over and over again by different people. And so that you can't help others until you've helped yourself kind of idea. It's the airplane oxygen message, that you get it on yourself before you apply it to your children and others around you. So I want to pause there. I won't go in, as I mentioned, to too much detail with the recovery phase. We might want to come back to that at another time. But because I do want to leave some time for your contributions to this, whether it be questions, comments, or suggestions. So Tanya, over to you.
Yes. Hi. Thanks, Nancy. Thank you for that. It was really comprehensive. And we've had a question from someone. Just quickly, can you repeat number 6 again?
Yes. Let me just go back here. Number 6 was normalizing psychological responses. It's okay to not be okay.
It's okay to not be okay. Okay. Thank you. Thank you. So I just want to return now to the initial question we had about someone who was wondering, as an employee, how do I approach management if I notice my coworkers struggling?
Hopefully there is a mechanism already in place for things like if you were noticing bullying or harassment in the workplace. I mean, there's lots of policies and directives around how that's to happen. This really is not a lot different, is that you don't necessarily have to have it come forward as a complaint, but more of an observation coming forward. But there really is sort of a duty of care to look at moving the situation forward. I would suggest that you think carefully. There's not a yes or a no, black and white on this, but think about whether or not you need or want the permission of the colleague before moving forward. I think it's an important privacy, confidentiality kind of piece, but also the support, that they know that you're on their side and you're willing to go to bat for them, or perhaps even better, go to bat with them. In terms of how to approach, I would really recommend that it's always ideal to come forward not just with a problem, but with a potential, one or more potential solutions. So that may take some creative thinking. It may include some talking to others, maybe doing some research, but coming forward with not just the problem.
Yeah, the person who submitted the question has added a little bit more information. She's saying that risking burnout herself, she wants to help coworkers without overwhelming herself. And it looks like perhaps management is not as supportive as they would theoretically need to be, but management does not have any involvement or support.
Mm-hmm. That's not unusual in organizations that are not faring very well on those, some or more of those 13 factors. I mentioned earlier that some of it falls to individual coping mechanisms and strategies, but a lot of it is about how the organization is managed. And one of the most common phrases that goes along with that is the organizational culture of the workplace. And so unfortunately, you may be within an organization that is experiencing some difficulties on many of these factors. Number 2 is named as organizational culture, and it's probably the one that is the most difficult to change. What I would take you back to as a possible strategy with this is, and maybe I'll pop up the slides again here to illustrate this one. Just a second.
And as you're doing that, Nancy, thank you, Liz and Aiden, for submitting that, and for all listening. I mean, this is a reflection on the perspective that your employees have on perhaps how you are delivering your strategies, and but it's a good reflection on the perspective of your employees.
Okay, I just want to move us to this framework. I know you can't read it really well, but I mentioned the key drivers earlier. These are the drivers that tend to, not all of them, but are the business case kind of for an organization to have uptake on the standard. Some of them will be motivated by risk management. So in coming forward as an employee, some of the story that you might want to tell is, what risk are they putting the organization at? That can be a pretty heavy motivator for managers. There may be some cost effectiveness that you can point out. I don't suppose that in our day and age that we're working with right now, that's probably the biggest one. And not so much on the recruitment side, but the retention of the driver of, we're going to lose these staff and we can't afford to be any lower on the scale. The other one is organizational excellence and sustainability. Many managers are motivated by how well they're doing vis-a-vis other organizations, other healthcare centers. So they want to be able to say at the end of the day that they've done well on this. So you might be able to draw some key messages from those drivers.
Thank you, Nancy. Thank you. Nancy, we've got a lot of questions because you were reading from some documents. People are wondering if we'll be sending out those links. I just want to give people reassurance that we will be sending out links to these various documents or citations that Nancy's been using.
And I do have them, I'll pop it up here now. I do have them on the last slide here. So the first one from the British one were those 10 principles and the 3 phases. I didn't really speak to the CAMH site, but there are a wealth of resources in a very specific section just for healthcare workers. So if you haven't checked that one out, there's a lot of excellent information in there. And then I'll save the last one because I want to finish what I'm going to speak to this afternoon with the last one that's here. Excellent. So that'll come to folks.
Excellent, excellent. I'm just looking back to see if we've missed any questions. Some people have suggested other resources. Someone is suggesting the working, that's a course. How about the resource for mental injury AMP from CCOHS Workplace Stress Management, Copenhagen Psychological Questionnaires, and they've got a link in there.
Mm-hmm.
And someone
others can see the chat comments, correct?
Yes, they can. Yeah. Yeah. Can we talk? Oh, and then you talked about the power of communication as well. So I think, Stephanie, that question was answered for you by Nancy, or let us know if you wanted to go into any more depth about it. It was about the power of open communication from so that staff members can be very frank about their current work situation, how they're feeling about it.
And I would just suggest that from that perspective, some anonymity may be necessary as well, depending on the sensitivity and the receptivity of where the communication goes. So if you're meeting with resistance, then often it's important that the communication goes to more than just one person, if that's feasible. So if there's a committee overseeing something, one person may pick up on something that someone else doesn't. Also, if there's an anonymity to providing the input, so through a suggestion box or something that's not identifiable, sometimes gives people a little more comfort.
Right. Right. Just Stephanie's asking more depth and more examples if possible. I mean, if I can suggest one that we do at York, at least within our faculty. I mean, within the chain of command, there is a way to have confidential conversations with people and who have made themselves trusted resources that you can have frank conversations with. But again, sometimes you feel tongue-tied when you are talking to somebody that is there to help you, and it can be a little bit intimidating. But if at York, if you have form a relationship with a trusted coworker or somebody who will, sit with you and help you get through it, perhaps that's another way you can do it with what we call sort of a third party who's there to help the conversation.
Mm-hmm. Almost like a mediator kind of role.
Right.
I see one other chat there that I just wanted to pick up on with reference to the workplace factor of work-life balance. And it has to do with, I mentioned those 4 dimensions of control, reward, demand, and effort. It has to do with the reward piece. So in our workplace, we have 3 weeks vacation plus 10 days at Christmas. The president has given extra days off at Christmas, and there was good buy-in when we were asked to give up vacation days now, in large part because we were treated fairly and rewarded appropriately. So that's an example of what could be done. They know it's coming. It's not necessarily feasible to do it right now. It's a good suggestion.
Right. And Nancy, we've got 4 more minutes, and I'm cognizant that everyone's probably in the middle of their workday and would like to help everyone get back to their day. Do you have any closing thoughts or closing remarks before we sign off?
Yes, I wanted to, I referenced it on the slide with the hyperlinks on it. Just yesterday, I read an article in the Toronto Star by a gentleman by the name of Dr. Gabor Mate, who is out on the West Coast, did a lot of work in Vancouver. He's a retired physician now and an author who really focuses in on addiction strategies as well as child development and a lot around trauma. And I want to reinforce with all of you the need for your own attention to psychological health. And here's what he had to say. And the article was, it was addressing both the pandemic and the difficulty, particularly in Nova Scotia, with what's been happening there. And it's entitled, "The Way to Get Through These Terrible Times is to Let Them Make You Sad." And so his comment is, and it was much more to the article, but I pulled out this excerpt. "When you notice any tension in yourself, take time to be with it, to accept it, give it quiet attention. Deeper, more authentic feelings will emerge. If you can, share those feelings with someone you trust. Grief is to be experienced, lessons to be gleaned from both of these tragedies. If we fail at that, trauma will be the result." That's where the mental health moves into the mental injury kind of element. I'm so pleased how many of you are interested to spend this hour learning a little bit more about this, hopefully taking away some strategies and ideas, and we may be able to follow up with some additional conversations around this. So from me to you, thank you.
And thank you all from Health Leadership and Learning Network, from York University. Thank you so much for taking your time to join us today. You're all very welcome. Lots of thank yous coming in on the chat. You're all very welcome. We really feel honored to bring this kind of information to you, to help you in any way during this time. Certainly reach out to us if you have any other thoughts or comments and want to share that. We're very open. Perhaps we can bring you another future webinar, but stay in touch with us. Thank you to all, and take care, stay safe, and we'll be sending out information to you post-webinar with the links that Nancy has talked through today, and the recording, of course.